Ihora lesihlanu qho empondweni ngikubingelele ngikwamukele mbukeli khona la kunqa phambili SABC 1 Mzansi for sure kumsombuluko ntambama siqala iviki elisha futhi siqala nenyanga entsha abaziyo bathi zi big days abaziyo bariki December boss thina la ku expressions sithi lenyanga inyanga ukuthi siqwashise abantu abasha mayelana ne HIV and AIDS ngikubingelele mbukeli. This is expressions right here on SABC 1. Well, today is World AIDS Day nokusuku olwaqalwa mbukeli inhlangano kamhla kuhlangene ngonyaka ka1988 isiqubulo salosuku kulonyaka sithi overcoming disruption transforming the AIDS response. Kade ke mbukeli kuzanywa ukulwisana naleli gciwane kodwa kubukeka sengathi kuyinhlanga zimuka nomoya ngoba abantu abasha kulelizwe basasuleleka ngegciwane le-HIV. It is estimated that nearly 8.15 million people lapha kwelengabadi are living with HIV. Ake sithi qu mbukeli lapha ku TikTok and engage with some of your favorite content creators who are living positively with HIV. Sizwe ukuthi what's the importance of disclosing nanokuthi futhi kubaluleke kangakanani to take your medication each and every day. This is what they had to say.
Throughout you finding out you're HIV positive, I strongly even advise you guys to talk to someone. I don't think it's fair to carry the weight of having the one virus that everyone hates and alone.
Small who told you it was HIV. The only way to break the stigma is to come out. The
thing is, people think HIV is like a faraway thing, like not anyone around them or in the circle has it. As big as the HIV rate is in South Africa, you wouldn't think your next door neighbor has it.
I'm beautiful. HIV doesn't define who I am. HIV doesn't define my personality. I used to say those positive words with my mouth.
If you mind saying ngeke ngivumele ukugula ngizothi treatment yami ngisinde ngibe right ngingatheleli omunye umuntu
lokuzithatha everyday tablets zakho so that inganyuki viral load yakho yabo.
If I'm on my ARVs and I'm undetectable, I can't infect you, but I do strongly suggest we use a condom.
And I've been living with the virus for iminyaka ewu-20 manje ngoba siku 2025 siyaphileka abafethi la HIV. As far as I find as an easy, I think it's even more better than other chronic disease.
Bayasho ke lapha emigwaqeni ya ku TikTok some of your favorite content creators bayasho ukuthi kuyaphileka nge-HIV and AIDS. Mhlawumbe uhleli lapha ekhaya nawe manqika awuzazi ukuthi umephi ngokuza kwezempilo. Don't worry, we have also lwazi lapha e-studio namhlanje who can answer your questions. So make sure that you call us on 011-794-0631. But joining me for this very important conversation right now, I am joined by Nga Morumbetsi, who is from AIDS Healthcare Foundation, and I'm also joined by Dr. Kamuchelele, who is a public health advocate, udokotela wezempilo. Lady and gent, nginibingelele nginamukele expressions.
Thank you very much, Azaria, and good evening.
Yeah, Nga, I want to start with you. You know, from a research point of view, we keep seeing numbers rising. Right now, our numbers in South Africa are about 8 million people are living positively with HIV. And I know that over the years, there have been preventative measures to try and bring the numbers down. Sihluleka kuphi as iningizimu Africa?
I think the first thing that you have said is, what does research show? And that's important that we continue to confront it, because research will help us to understand where are we doing things right or what are we doing wrong. Before we started the conversation, I was chatting to Dr. Kam and we looked at even something like discrimination and stigma and what are the contributing factors. We are doing great in advancing prevention modalities, especially the new emerging biomedical. Lenacapavir is gaining popularity. What can we do better with that to ensure that we're reaching more people, not only in South Africa, but also across the continent? Information, awareness, and literacy. How do we collaborate with communities? But before even that, one of our TikTokers, they mentioned that even if you're undetectable and you're virally suppressed, I would strongly advise you use a condom. Let's go back to basic for the prevention. I remember a generation, I'm part of the generation that was within the ABC conversation, abstain, be faithful, and condomize. Condoms remain the most effective cost effective, but also effective in preventing STIs and unplanned pregnancies.
Yeah.
So we need to popularize our prevention modalities should be combination, not either or,
Yeah.
to ensure that we continue to get the low rates, but also to combat the high rates that we are seeing in other areas. So let's continue with prevention mechanisms.
Dr. Kamu, just to bring you in on the conversation as well, Unga just mentioned a word elithi undetectable. Kukhona ugogo ohleli esinqanqawini enquthu right now umuntu omusha and they're asking themselves, undetectable uchaza ukuthini? If you were to simply explain to abantu ekhaya, what does U equals to U mean?
So this is my favorite part about HIV.
Yeah.
U equals U. Undetectable equals untransmissible. So if someone there at home is to take their treatment faithfully for about 3 months,
Yeah.
then there will be what we call virally suppressed. It means the virus in their body would be suppressed, would be kept down, would be in prison. That means that that person cannot transmit the virus to another person who is HIV negative.
Okay, so basically uma uthatha amaphilisi wakho ulandela imigomo kadokotela kuhambe isikhathi ufinyelele ephuzini la igciwane is not that powerful emzimbeni wakho liba suppressed ngakho awukwazi ukuthi ulithelele ulidlulisele omunye umuntu. We had the G20 not so long ago. We hosted the very first G20 on African soil as the city of Johannesburg, and one of the cornerstones of G20 was them speaking about funding when it comes to healthcare. How important is funding, especially in the southern hemisphere? Because we know ukuthi ezwenikazi lase-Afrika singamazwe afana no-Botswana, Namibia, South Africa, ikati lele ziko. Therefore, why is it important for us to have funds to continue our research ku-HIV?
I think we need to take a look at how do we bring it up. So let's take it back even before the G20 conference. The conference on public health in Africa, the fourth one, was in Durban. And one of the key conversations was around funding. Funding for sustainability. Funding allows us to also be in charge of our research modalities. We have something that is called pathogen access and benefit sharing that we continue to advocate for in public health. Simply put, that means that when they get pathogens to research, we often send them away and then have to advocate for them to come back when they have developed vaccines, for example. So that is because we don't have the capacity to carry out the entire research sequence and the development sequence for things like vaccines. Now, why should we invest in something like research and development, for example, in something like strengthening our public health structures, in something like universal health coverage or mechanisms like pooled procurement? Simply put, money talks. You are able to control a lot of things. We're seeing our president is also speaking very strongly on that. But for us to be able to navigate our public health system, not just for HIV/AIDS response, but our entire public health system, even looking at integrated service delivery, we need funds, we need resources, we need for our governments to be the ones who are taking control of our HIV funding response.
Let's talk about vaccines, Doctor. Bekhona amahebezi akhona ukuthi manje sekuzoba khona umjovo that a person can take twice a year. Tell us a bit about that. I know that sometimes there's still a bit of research. There are trial runs that are still ran. Just tell me a bit about umjovo. Are we in the prospects of receiving umjovo like South Africa anytime soon?
So what you're talking about is what we call PrEP,
Yeah.
pre-exposure prophylaxis. So what we have currently in public service are pills that someone needs to take every day.
On a daily basis.
People get tired.
Yeah.
You understand? So we have an injection that we call lenacapavir. Lenacapavir.
Okay.
Yes.
Siyafunda namhlanje.
Yeah. That you'll have to take twice a year, meaning every 6 months.
Yeah.
That will reduce the burden that people always have by having to take pills every day. Yes.
Yeah.
But it's for PrEP.
Yeah.
Pre-exposure prophylaxis, before you get the virus.
Yeah. Talk to me about the psyche. Umqondo womuntu when they have to take pills every day. I do understand that there's apathy. Uthatha amaphilisi each and every day. Affecta kangakanani umuntu omusha lo psychologically?
So from a young population, it's just that thing of, why am I taking pills and my peer is not taking pills? You understand? Why am I different? Do you understand? Another thing as well is when they go to the clinics, the stigma that they get. My neighbor's going to see me. What are they going to say? Do you understand? So it's not just the self-stigma that we're talking about, but it's also the general stigma, what they receive from the community itself.
Okay, thank you so much. Ake mbukeli uthini umbono wakho nje obuhleli lapho ekhaya? Ngabe ucabanga ukuthi zikhona mhlambe inzame esizenzayo njengezwe laseNingizimu Afrika ukuthi siqede ihlava se-HIV and AIDS lapha kwelengabadi? Okwamanje ake sithi qhu eyitolo ungayindawo. This is Expressions right here on SABC1. Siyabuya. Kwandengezi kwadukuza kwaSwayimane noma ikuphi la usibukele khona njengamanje mbukeli isihloko esikhuluma ngaso namhlanje lapho ohlelweni siyakuthinta nawe. Namhlanje mbukeli sibungaza iWorld AIDS Day. Umbuzo uthi ingabe uyakwazi yini ukuthandana nomuntu ophila nalesifo wena ube ungenaso? Ake sivakashele esifundazweni sase-Eastern Cape sixoxisane noAvumile Zanaye kanye noAvuyile Duda who will tell us about a bit about challenges that they face as a couple. How difficult is it?
Abafuneka ukuthi sebenzise ipilisi because angikhulanga like ndisela ipilisi. Now I have to start prep, and at the end of the day uyamthanda loo nto, and then there's nothing that you can do to change istage sakhe. As by ixesha and then as banam ndisenze research ndabona about there are ways around it.
HIV is still a taboo topic. But also you should bear in mind that HIV is not the end of the world. Where ngabonakala ingathi ndithetha ngathi it's easy, it's not easy, because there is also still discrimination around it. But here I am living positively and have my own baby. Like we have our own baby who is negative, my partner is negative. They use treatment, PrEP, so that you don't get infected. And if you stick to ARVs, you will reach the level of undetectability, meaning that you can't transfer the virus to your next partner. So there is life, Bandase, and I'd also encourage that you get yourself a support system, because honestly, you can't do this alone.
Bakhuluma ngokubaluleka kwe-support system. Well, joining me for this conversation right now, I'm joined by Thandeka Msuthu. Thandeka, welcome to Expressions this one.
Hi, how are you?
I'm good. We are commemorating World AIDS Day namhlanje, and we just saw a clip right there, Usisi ekhuluma about the importance of having a support system. Umuntu ongakwazi ukuthi uncike kuyena. I do understand that you are 21, you were born with HIV. How difficult was it for you to maneuver through high school, esikolweni, nabangani bakhe, and also disclosing bekunzima kangakanani for you mawukhula?
Okay, so after finding out about my HIV status, I was still young. I didn't know anything about it, and I was one of the people that I didn't take it into consideration at that time.
Yeah.
And then I started going to high school, started learning more about HIV, what is HIV. And the fact that I had to take my HIV medication every day, it didn't sit well with me, because I thought I'm the only one who's living with HIV. I used to blame my mom, my dad, why am I living with HIV? Why am I not like other kids? Why am I taking my HIV medication every day? And I didn't disclose to anyone. The only people who knew about my HIV status was the people who are living with me, my family only. And then I thought to myself, you know what, since I struggled through this HIV journey, I think I just want to talk about it on TikTok and try to encourage people about it. Because when I was in high school, I didn't watch anyone on TikTok talking openly about HIV. So that's why I took the opportunity to say, you know what, I think I'm brave enough, you know, to talk about it on TikTok.
And I am following you on TikTok, and I love the content that you put out there, because you are positively impacting people abasemakhaya. Do you think ukuthi kubaluleke kangakanani for you to use TikTok yakho for advocacy? Because abantu abasha, they use TikTok for ukujaiva, but when you are using TikTok for a tool yokufundisa abantu abasha out there, which you didn't have when you were young, as you've just said right now, why are you using TikTok as the advocacy for HIV and AIDS?
Okay, so I'm using TikTok because of I know that young people are always on TikTok. So as I said before, I didn't have anyone to look up to when I was still growing up to talk about HIV openly about it. So that's why I was like, you know what, I think I'm gonna take steps to talk about my HIV, because I know if somebody's watching at home, young, and listening to me talking openly about HIV and they have HIV, they will feel less alone. You know, they will feel like I'm not in this together. I'm not not only on this alone. So yeah.
Okay, let's speak about stigma. I do understand that you're a young lady, and as a youth show, we know that ababukeli bethu, they do go out on dates. How important is it to disclose, especially uma mhlambe nizama ukwakha ubudlelwane relationship wise, because bakhona abanye abantu abasesemanqikanqika, abanye abantu bayafihla bayasaba. Why is it important to disclose?
I normally say I disclose on the first date. It can be on a first date or us talking over the phone, because I feel like it's important for me to do that. If you tell somebody after that, you know, also catch my feelings, there's nothing that you can do about it, and you're gonna go through the process and feel like that person doesn't love you anymore. So it's very important to talk about your status as early as possible, to also protect that person, you know, because you guys can have sexual intercourse and everything like that. So it's very, very important. I say on a first date, then umuntu has decided, am I staying or living in the relationship?
Let's talk about your lived experiences. You know, is stigma sinjani out there? Do you sometimes, when you disclose to someone, then you find yourself being blocked now? Someone has gone AWOL on you now, you know, you don't know what ghostile. That's what I was looking for, that word, ghostile. How is the stigma out there? Do you think that young people are cognizant and bafundile enough to know about this and know you equals to you?
Yeah, to be quite honest, I do get ghosted. A beautiful lady like you can live with HIV. And to be quite honest, I am comfortable with my status to a point where even when I tell you about my status and you ghost me as a guy, I'm still okay with that. And it's stigma, to be quite honest, so now people have negative comments about HIV. You know, some people will say you got it when you were busy sleeping around, and if you know your truth, then there's nothing to explain out there, you know. And you need to know when you're coming out about your HIV status, people will always have negative comments about it. You just need to be brave and don't listen to negative comments.
Let's speak to a young girl, Odutsi Honano, Homashashane, ko Limpopo, ko Paris, ko Free State, who is feeling very depressed because they literally just found out days ago that they are HIV positive. Word of advice, how do they pull through? My
advice to that young girl or that young lady, I will say to them, it takes time, to be quite honest, to accept your HIV status. You know what, I'm comfortable with my HIV status, because I took time, and I also said on my TikTok, nothing helped me like prayer. Even though I was going through tough times, I made sure each and every time I talk to God about it and say, God, you know what, I don't know why I'm living with HIV. Can you please help me to accept my HIV status? And I just want to say to that young girl, drink your HIV medication. We look beautiful. We're taking our HIV medication every day. And don't mind our negative comments and you'll be fine.
Thank you so much for joining us, Thandeka, right here on Expressions. Well, Mbukeli uzizwele bathi kuyaphileka. Okwamanje akasithi ku $8. This is Expressions, siyabuya ungayindawo. Hlala phansi mbukeli nethezeka siphokophele phambili nohlelo. This is Expressions right here on SABC 1. Ungakhohlwa ke mbukeli ukuthi nawe ungaba ingxenye yalolu hlelo, shayele ucingo ku 011-714-0631. Mhlambe nawe nemibuzo mayelana ne-HIV, because siyazi ukuthi kule minyaka eminingi edlule there's been research that has been done. Ziningi izinto ezivelayo. Osolwazi bakhona lapha e-studio. Uma ngabe unombuzo ungasabi ukusifonela bazokwazi ukuthi baphendule umbuzo wakho. Just coming back to you, I want us to speak about the trends that you guys see on the ground. We do understand that a lot of young people are infected by HIV and AIDS, and abanye baphakathi kweminyaka engu-15 to 49. You know, these are young people that some of them are still hopeful for the future. Some of them, they still want to build families. Ucabanga ukuthi what influences le trend le ukuthi abantu abasha kube yibo abathola lesifo kakhulu?
Thank you. I'm very grateful that you said 15 to 49, because I thought you meant I was a young person, but we focus on 15 to 24, which I think gives us a wide breadth Through something that we call a Girls Act program, we even go below to 10. And why? It's because we've seen social behavior amongst the adolescent. Usually it's girls that are researched, but we see the adolescent population. And within that, we look at the economic influences, the social influences, the cultural influences that shape the behavior. Then we look at what is the access to information, what are the perceptions that are popularized. I was so excited to hear our young lady talk about, she's realized she has an opportunity to influence the narrative. We look at how do people perceive things like stigma and discrimination. We look at the impact of things like family structures. But one big key contributor that we see is how young people are navigating issues like the availability of PrEP, vis-a-vis how they're understanding things like STIs and pregnancy. So definitely it's in understanding behavior. Our young people are more prone to risky sexual behavior, which is something we need to address.
Speaking about being prone to risky sexual behavior, Dr. Kamo, we know that we have preventative measures like PrEP, condoms. There's a lot. And even when we were still in primary school, we were still taught about HIV and AIDS. And yet still namanje, years later, abantu abalingana nathi, they still find themselves bahaqwa ile simo. Do you think that as young people, we are reckless, we are not cognizant enough?
I think to a degree,
yeah,
because we can't emphasize the importance of using a condom. You understand? Because it's not just about preventing HIV, but also other STIs. Talking about preventative measures, we have PrEP and we have PEP. PrEP is for before you are exposed to the virus. And PEP is for after you've been exposed to that virus. And for someone who's taking their PrEP every day, right? And they have this protection against the virus. They still need to use that condom so they don't contract the other STIs.
Because there are other STIs as well. But right now, Spura, the level, is standing by. Good night.
Zojabula when we are dele, lana zojabula. Zojabula when we are dele, lana zojabula. Zojabula when we are dele, lana zojabula. Zojabula when we are dele.